It's back. The chair recognizes the gentleman from Florida, Mr. Bilirakis, for 5 minutes for questions.
Thank you, Mr. Chairman. I appreciate it. Ms. Arthur, your testimony brought up a sobering question. As a nation, are we more prepared more prepared than we were in 2019? And that, unfortunately, I don't think we are. I think part of this reason is due to the administration's red tape and reliance on bureaucracy. What we should be doing is replicating one of our COVID successes through public-private sector partnerships, in my opinion. Could you elaborate on the agile nature of the private sector and specifically your members? What does their nimbleness mean in the testing and diagnostics space?
Thank you very much for that question. I think across the board, industry actually does several things really well. They analyze what they can do to solve a problem. They understand what they need to do to bring the best product to market that's going to serve the need, that unmet medical need being met. And more importantly, they move really swiftly to make go, no-go decisions. So you build a test, you see if it works, you understand if there's safety issues, and you move on to the next step clearly and swiftly. And I think that is what we saw with Operation Warp Speed, was there was that facilitated environment by the U.S. government and that expertise brought to bear by industry on how to make those very rapid go, no-go decisions, all within the confines of very clear guidance for manufacturers of vaccines, tests, and therapeutics, such that companies were delivering products swiftly, but still very safely and manufactured at high quality.
Excellent. Dr. Parker, you similarly speak to the role that coordination plays in responding to novel threats that could catch us flat-footed and unprepared, God forbid. Specifically, the importance of relationships not only between the federal government and the private sector, but also with state and local governments. The Countermeasures Advisory Committee bill also requires the Public Health Emergency Medical Countermeasures Enterprise to solicit state and local feedback as part of its decision-making. Can you discuss the role of state and local feedback in addressing their communities' specific needs during acute emergent situations such as natural disasters or disease outbreaks?
Sure, and Dr. Washington is on the front line, and it's absolutely essential that the federal government include input from those that are on the front line in state, local, public health, particularly territorial and tribal communities as well. It's just absolutely essential, and we need to have that input. Essentially, they're setting the requirements. I always think of things in the requirement space, and that drives what our funding should do. So they should be helping us drive those requirements.
Thank you. Mr. Okun, on the topic of preparedness and prevention of supply chain disruptions, you talk in your testimony about the need to incentivize, and we went over this, but I want to ask you, again, the need to incentivize generic drug injectable manufacturing, reshoring here in the United States through value-based incentives. Can you elaborate more on this idea, sir?
Well, value-based, Mr. Bilirakis, value-based is the name in healthcare now. And basically, over 75% of these drugs are manufactured overseas. We need to bring it back in the United States, and we need to basically have acceptable quality measures, which are agreed upon. And when a manufacturer hits those quality measures, keeps the products going, keeps the production lines going, then they would basically get an incentive there. Let me just make this very clear. This is not about big name, expensive brand drugs. This is about low-cost, sterile injectables. It's a very different animal, and the people and the companies that are making this are very different than some of the large manufacturers out there. These come from China, India, and whatnot. So I think if we thought creatively in terms of value-based arrangements, we would be able to bring manufacturing back in the United States. But the fact of the matter is, again, the FDA commissioner said it. If no one's going to make money on these drugs, they're not going to produce them. It's as simple as that. And I'm not against any of the warning signals, the things that the FDA should be doing and whatnot. But the problem is, until we realize the fact that there is a basic financial issue here, we're going to have more shortages.
Okay, thank you very much. I appreciate that, that answer, and I should probably yield back the balance of my time in the interest of time. Thank you.
Thank you. The gentleman's time has expired. Gentleman yields back.